became the first general manager of the cooperative. The questions that were directed to me has been the very early years of group health and how it really became organized and had its initial breakup into the community. This was quite interesting. My first meeting occurred in the end of 1971. At that time, the Consumers Co-op Association, under the leadership of Ray Tyson, had called some public meetings to see if there was some way to start a cooperative prepaid health plan in the community. We had three obstacles that we faced. One, we didn't have any medical people on staff employed. And of course, if we were a sickness and wellness program, we had to employ a medical staff. At that time, that was really your definition of HMOs. They were all staff models in the country. And so that was an obstacle. We didn't have any reserves built up to show that we were capable of being a health maintenance organization or any other kind of an organization. We didn't have the money, and that was a huge problem. And we, at that time, didn't really have the support or the people involved in of the various community groups to be able to make it a reality. So we made the decision as a board, after about 4 months into the feasibility study, that we'd go for it, that we would try to go without additional funding and just start up. Because what we had when we went into the groups, we had the image of being a new program, brand new, with our heart in the right place, being our members in a cooperative movement. And we opened our doors on November 1st, 1976.
I'm Mary Glassbrenner, and when I joined Group Health and had the opportunity to be an employee, at that time was back in 1979. And so the organization was really just starting to grow. And looking back over the years, I remember when we first, were opened the clinic. Back then we were licensed as what they called a staff model organization. So what that meant is that you owned your own clinic and hired your own physicians and staff to run the clinic. So when you look back and think that when we opened our doors, we had one primary care physician and one nurse practitioner, and then a handful of ancillary staff, like radiology, lab, and administration. And we had to go out to companies in the local community and convince them to offer group health as an option for their employees. And we only had one physician. So it was quite a challenge at that time, but again, it was because of the community support that people had heard about us, were believing in us, and some of the early companies that came on, like Hitch Services, Eau Claire Board of Ed, the school, the city of Eau Claire. It's amazing to think that those companies are still with us today. So they've rode the ride with us for a long time and were committed, believed in the organization. And so it's good proof that the community really stood behind the organization. One of my more challenging events was going out to the larger groups to sell group health to them. And one group that always comes to mind is the old Uniroyal group that was in Eau Claire. It was difficult to try to break into these big groups because they were not local companies. They were run out of state somewhere. So a lot of times you had to deal with the leadership from out of state. So the day that we finally landed the Uniroyal contract was quite amazing for me. And I remember that day so vividly because that was the first time that they ever videotaped the presentation to the employees, because back then they had the Wausau plan, which was the Red Apple plan, and to come in and replace that program was a big type of event that was hardly, people never thought that that would really happen. And so they had all of the presenters up on stage at that time where you talked about your own company. And then they offered you as a dual choice, which meant that the employees had their choice between group health, or they could choose the Blue Cross, or maybe it would be the Middleford program, the Valley program at that time. And so people had their choice. So you really had to sell to the people why they should choose you. And I never thought in a million years that, we would ever get anybody out of that group through this type of presentation, but I was shockingly surprised that, group health did very well. And when we got completely finished, a lady came up to me and said, she said group health was the best presentation that I had heard. And the reason being was because it was local and it was community, and you could talk about how you were right here and you were going to take care of the people, because it was our #1 priority. Where other people, they had administrative staff to go through. We had it all right here in one building. And so people looked at that as that you really cared for them.
I'm Pete Farrow. I'm the General Manager and CEO of Group Health Cooperative. I think what's interesting when we look at where we are today and how much different healthcare is, how much different insurance is, how much different this organization is than it was even 13 years ago when I started with Group Health, and certainly 30 years ago when the Cooperative was started, is while it's more complex, we are still very tied to those roots and the ideas that helped form the Cooperative, the connection to our community, the local service, the attention to our members and the role that our members play in the organization. They're a central focus of everything we do. And as we work through the changing way that we deliver health insurance and the growth that we've been through, we had 22,000 members 15 years ago, and up over 75,000 members right now, and $250 million in revenue. We still go back to those roots. We still go back to the key ideas that we're here to help optimize the healthcare of our members, and we do that by keeping the local connection, by making sure that everything we do still has a very personal focus on our individual members. Health insurance and healthcare are complicated. They're always going to be complicated. They're always going to be intimidating. And to the extent that somebody knows that it's their neighbor helping them down the street, we try and take a little bit of that intimidation out of the whole process. Help them even learn what questions they should be asking their doctor, or go just a little bit further into something so that they understand a little bit better. It'll all help improve their health care, and then work directly with their doctors or the hospital that they're dealing with to create a better level of communication, and just make sure that the links that are supposed to be there in healthcare, that all too often in our current system aren't, because the system has become so complicated. We helped form that link, and that was that comes right out of the essence of what the Cooperative was formed to do in the 1970s, and still something that we think is very important today. One of the good examples about service and how, when we talk about the way that we relate to our members and bring the community focus back to everything we do, is just even the way we answer our phones. And when I started 13 years ago, we had 22,000 members. At that point, we answered our phones live with a receptionist. When we got to about 35,000 members or so, I remember the team coming to me saying, it's time we had to put in an automated attendant. We've got one of those voice trees where you dial 1 for customer service or 2 for problem with your billing or something like that. And I, at that point, said, no, we can figure out a way to keep answering the phones, and we need to make sure that we maintain that link with our members, that insurance is imposing and intimidating, and to the extent that we can humanize it, that's the role of the Cooperative. We want to make sure that they feel like they're calling somebody just down the street, and the best way to do that is have them talk to a voice they recognize. It happened again about 3-4 years later. We were up around 60,000 members, and the team came to me again and said, maybe we need to figure out a way that we can answer the phones differently, because it's getting to be a lot, and we just, you know, probably should automate like everybody else has. And I made them a deal then that, that we could put in an automated attendant right after my funeral. Just to reinforce the point that for this organization, for us to maintain our close contact with our members and feel part of the community and make sure that from our members' perspective we're part of their community, we need to always have that very local touch and that, you know, kind of a live answer feel, and it permeates everything we do.